So the year was 2003. I was more than 7,500 miles away from home, and I was thrilled. I had prepared, I had been taught, I had reflected on global health culture and Swahili culture. This is the reason why I was in Tanzania and Nairobi, Kenya. And then the bombs started to fall. In late March, our country declared war on Iraq. And the very reason in which I had gone to be a global citizen of the world around me, to learn to be more culturally competent and check those boxes, my space, my body in that space became dismantled in a moment. The State Department, who was tracking my every move in another country, said, "We are not going to limit you staying here in East Africa, but you can no longer travel to the rainforest of Uganda where you had planned to study health and medicine." So instead, my wonderfully amazing Danish professor, "We've got another plan. We're going to go to Arusha, Tanzania, and we're going to stay with some Black Panthers who are living in exile there." My world stopped in a moment. I had come to East Africa as an African American female, but I had not prepared to learn about African American culture. I had no idea about what it meant to be a Black Panther in exile. And I knew, as one of 10 students on this cultural excursion and the only African American, that I would be called to task for understanding the very cultural and self-awareness that had brought me to this place, that I had been able to travel the country and enter into colleges and learn about how free breakfast programs in which they had started were the very essence of health in a community. And I was not prepared. Thankfully, when entering into the compound of the UAAC, Baba Pete, who immediately told me to call him by the Swahili name of father, said, "You are welcome here. And this is your chance to listen, to learn, and to reflect on all of the many things that have brought you to this moment." So as I think about cultural competency, and I've entitled this talk that cultural competency cannot be taught, it is really a chance for us to go beyond and to think deep. And that starts with our self-awareness, our awareness of the communities that have brought us to where we are, and the global world in which we are all citizens. So I returned from East Africa, and only having to be evacuated one day earlier than I had expected to leave. And I came back to a much changed United States. I came back to a much changed Brandy in terms of what did my place, what did my role in the world in which I now inhabited, what did that mean for those who lived around me and were also going to be the future generations to come from me. And so I thought about those lessons. I thought about listening intently to the stories that make us who we are, listening to the lived experiences of others and learning from that, knowing that that is just as rich of data as it is what we read in history books or the numbers in which we see on our census tallies or any other data points that we might be used to. And I thought about that moment of reflection. What are we going to do differently in our lives to be more culturally humble, to be more culturally available to all of the things and all of the people that want to share their expressions of joy and visions for hope, for a future of their own personal agency and the well-being of their communities with us. And not just stopping there on listening and learning and reflecting, but that this cultural competency, this thing that we call, this has to be a constant journey. And paradoxical in many sense, that there is no end point to where we're trying to get to. There is not a destination that we're trying to reach with cultural competency, but it is a constant repeat and reflection of who we are. So that led me through multiple years of more education and traveling the country and going across chasms that I would not have expected, that were places that I already thought that I was aware of. Talking with young Black girls around the country between 12 and 22 years old about their excitement and their joy for who they were. When did they find out that they were a girl? When did you first know that you were Black in this society? What is your vision for the future? Many years after that, I was asked to come here to Louisville to run the Center for Health Equity, which has been doing this crossing of cultural lines for over 10 years in this community. We have a stark number, a stark story that we tell here in Louisville about the differences of those spaces and those bodies that are in those spaces. This image that you see here is a map showing life expectancy in Louisville. From one zip code to another, there is a 16-year life expectancy gap. From one side of our city, where you see the lightest colors on this map, people live the shortest lives. Everything due to air quality and their access to healthy foods and vegetables, and even if there is a clinic that they can go and take care of their very basic needs. But the Center for Health Equity, we've been going deeper than just what these pictures or these stories tell. We've been crossing that chasm in our community, that 9th Street divide that we so easily and readily talk about. We've been asking, what is the root of this? How did we get here? How do we listen to the faces and to the voices behind these numbers, behind this map? How do we reflect on the stories that people tell about their lived experiences day in and day out, and that oftentimes it's not just that I don't have a doctor to go to, but sometimes when I go to that doctor doesn't even look me in my eye because I perhaps am the wrong color, perhaps I don't speak the current or correct language that the medical community is wanting to talk about. Or perhaps it is just the stress of walking down the street and knowing that you look drastically different from those who are in power around you. So when we talk about cultural competency in the Center for Health Equity, we're actually talking about how do we change those systems and those structures to make it to where there is not a box that we need to check if someone is culturally competent or aware or not, but that we are providing a space where everybody can live their fullest life possible and thrive despite where they live. Knowing that your geographical area or that your zip code should not determine your life destiny. It should not determine if you are able to live or die. It should not determine if you are able to be at your child's graduation or not. In the Center for Health Equity, we are starting this work right now more intentionally in terms of putting into place actual ways in which we can operationalize the policies, the programs, the budgets that go through our public sector. Who is most burdened by the decisions that we make? Who is most burdened by the lines that we decide not to cross in our community, or the stories that we choose not to face around our own cultural blind spots? Those cultural blind spots that I might also have had in 2003. One of the ways in which we are doing this is talking about race and racism as a root cause for people's health. Oftentimes we say, well, how does culture and race and ethnicity, how does that impact people's life outcomes? When we look at this map and we see those lightest areas on the map, we also know that that correlates where there are a majority of people of color living in this city. So is it just really crossing into a zip code, or are there more about those bodies that are in these spaces? And when we look at this, we know that the impact and the oppression that happens when people are losing their lives, 16 years less life lived than others, that is impacting those at the top as well. The United States is in the 5th quintile on the global inclusiveness scale out of 138 countries. With all of our resources and all of our assets here, the United States in the 5th quintile. The United States is 53rd in life expectancy for countries around the world. With all of our resources, with all of our assets, with all of our prowess, why are we 53rd in life expectancy? So when you look at this map and you see just a tidbit of what it is looking like in this country, in our state, and around the world, we see that where there are large gaps in income, in life expectancy, between the highest and the lowest, there are going to be lower rankings for us all. So when we ask that question about why is the United States in the 5th quintile out of 138 countries on the global inclusiveness scale, or why is the United States 53rd in life expectancy in all the world, we can start asking ourselves questions about how culturally aware and inclusive have we been in terms of asking people their stories and not sharing our answers with them, but reflecting and actually repeating that process and going through the journey with them again. So as you think about the work that you do and the life that you live, I would encourage you to cross those chasms in your life. Cross those spaces of the 9th Street divide that we have in this community. Who are you most concerned or feeling marginalized by? How can you have a conversation with those individuals and those institutions so that you might also be aware of what those cultural blind spots might be in your life? So no, cultural competency cannot be taught, but it very much can be learned if we start to open up the spaces in our own worlds. Thank you.